Goedemiddag, welcome, good afternoon. Thank you for joining us at this Risk Communication and Community Engagement Strategies for Chikungunya webinar. Thank you for taking the time to be with us today from your busy schedules on a Thursday. Thank you for the colleagues who are joining us. For them, it's still the morning. We are already in the afternoon. And thank you for your attention. So this webinar is part of a series of webinars being conducted because Suriname is facing a chikungunya outbreak at the moment. And the PAHO, the WHO, and the national health authorities are working together to combat this outbreak on various levels. The previous webinars were aimed at the clinical treatment, the technical subjects, and this webinar is aimed at how we as a whole can communicate with our community, engage in the same messaging, and stay consistent and also distribute the correct messaging. The webinar is scheduled for an hour. We will offer you the chance to ask your questions in the chat. And at the end, our speakers will come back and address them. If you have a question and it's for a specific person, please mention that as well. If you go down, I'm going to switch to Dutch now. Voor de mensen die behoefte hebben aan vertaling, u ziet beneden bij de balk een kleine aardbol en daar staat er interpretation. U klikt daarop en dan ziet u het kanaal waar er staat Dutch. En dan selecteert u dat voor de Nederlandse vertaling die simultaan is bij deze webinar. We gaan direct van start. Mag ik de eerste spreekster... I'm sorry, I have to switch back to English. Sorry, Tanya. The first speaker will be Tanya Escamilla. Some of you who are in this webinar have already met Tanya. She was here last year when we had our One Health exercise. Tanya is a very experienced apologies, very experienced professional when it comes to the matter of RCCE, and we are very grateful that she is going to share her experience with us and give us some insight as to what we can apply to the Surinamese situation in order to deal with this health emergency. Tanya, welcome.
Thank you, Ramona, for your kind welcome, and thank you everyone for being here today. It is really an honor to work with Suriname again. As Ramona said, I had the opportunity to meet some of you in October last year, and I hope that today this presentation that is going to focus on the role of risk communication and community engagement during outbreaks, specifically the part of the community engagement is useful for the work that you do every day in the communities and the important response that the country is carrying out with its partners for the Chikungunya emergency. I am going to share my presentation, my screen. You give me just 2 seconds. I just want to confirm, Ramona, that my screen is visible.
Yes, Tanya, everybody can see the screen? Yes, please go ahead.
Thank you, Ramona. Well, my name is Tanya Escamilla. As Ramona said, I am the communication specialist for the Health Emergency Department at the Pan American Health Organization in Washington, D.C. I lead all the technical cooperation related to risk communication and community engagement for health emergencies, preparedness, and response. And this presentation, I want to start with a reminder for all of us, because maybe we have some attendees that are not that familiar with the concept of risk communication within an emergency response. And it is very important to situate ourselves in the present environment where communications hasn't been for a long time a one-way um, process. We are in an era, we have been in an era for the last 20, 25, 30 years where communications is an exchange. And we now know from several of the lessons learned from the COVID-19 pandemic that instructions and just transmitting information doesn't really work. I also want to highlight to start with that RCCE, Risk Communications and Community Engagement, is one of the 15 core capacities of the International Health Regulations, which all of WHO state parties, of which, of course, Suriname is part of, must develop to better prepare and respond to a health emergency. So it is all about giving the people the information that is accurate. So that is really important for people working in communities and people working in communications to engage with our technical colleagues, the colleagues that work in the other pillars of the response who have the latest scientific guidelines and accurate information for us to share this accurate information with communities so they can not only make the decisions to protect their health and protect their families, but also participate actively in action. And that means that we are partnering with communities as equal actors, not only as people receiving a message. And this is very important because this component of partnering really will help us to build the trust. And building trust and trust itself is the basis of risk communication and community engagement, is the basis that will allow us to effectively mitigate and respond with the community to a health emergency, not only chikungunya, but any other health emergency that the country faces. Trust also help us reduce the impact of the rumors and many sometimes incorrect information that day to day we know that is circulating in the community. And it also increases the chance that the community will adopt this protective health action during the emergency. So there are two parts of, and in the name is very clear, risk communication and community engagement. And today the presentation is going to be based on more of the community engagement part. My other colleagues in this webinar will, of course, speak to other information that is very important for the risk communication work as well. So why are you important? Because I know many of you that are here today are community health workers, are workers that are performing health promotion actions in the community. You face community every single day, and you are really the bridge between the response teams and all that technical operation system that already is in place in the country and the community. So your role is very key in order to have compliant results in the response. And I am going to emphasize some practical advice for you to follow when you are in your daily work with the community. One of the main things is in order to promote and really deepen the trust is to be a regular presence. So we need to schedule, and I know that you're already having the visits and some other work in the field. So how do we make that presence regular if that's not the case yet? But this is very important, not expanding the time between visits, but trying to have a regular timing for these visits and engagement with the community and these activities. We are going to talk more about rumors in one of the other presentations, but this is very important. Rumors do not circulate only online. Today we talk a lot about infodemic management and the role of the digital world. But when you go to the community face to face and talk to them, you can also be knowing about the rumors that circulate, not necessarily only in social media, which many people don't use still, But when you hear about these rumors in your community activities, we need to have prepared messaging for a clear and kind correction, and really to understand more where these rumors are coming from before they spread and they erode trust. And here again, it is very important to have a constant connection with our colleagues on the other technical pillars so they can provide us with the clear information that's accurate in order to respond to these rumors. We need to carry the feedback both ways. So as the bridge, we carry the feedback from what are the community concerns from the community to our other technical colleagues working in the response, because we need to produce information and design risk communication and community engagement activities that respond to the community concerns, to the community doubts, but that also respond to the plan that the response has in the emergency operations group or the incident management system, as you have already in the response in your country, and all the technical pillars that are set up. So risk communication is central in that it provides feedback both ways so that the technical side responds better to the needs of the community. We need to demonstrate our actions. So if we are engaging with the community in some part that maybe we are not familiar or we don't live near that community, we need to also be working where we live and setting the example and correcting the rumors, even in our personal groups, in our family interactions, and also being respectful of the, of course, of the cultural diversity, which is very, very important in the Suriname context. So I want to expand a little bit more about some steps that we have, and this is an adaptation of WHO material for community readiness and the community work. And it expands a little bit more on the foundational work that we need to perform when we are facing an outbreak in any type of health emergency, again, not only vector-borne. So listening to communities, as we have said before, and this includes listening to fears and some beliefs that the community already has around the threat that we are working to respond to. Use simple and clear messaging, and my colleagues later on are going to speak more about this, but we need to use plain language and also in the way that the community connects with their context and providing the actions that are available to them. We need to be transparent and acknowledge uncertainty and say clearly if we don't know yet some sort of information or some technical point, say we don't know yet, we are working on it, and I will provide you with the answer, but never try to respond without being sure if the answer is correct. And this is something that we need to practice more, how to communicate when we receive some questions from the community that we cannot answer clearly and rapidly, but we need to do some connection with other colleagues in the response in order to provide those answers. This prevents misinformation because it's better to say, I don't know yet, or I don't have this information yet, than spreading some sort of inaccurate data that will turn into probably some false information circulated. We need to be culturally appropriate. As I said before, this is very important in Suriname and in many other countries of the Americas region. Speaking the language which the community speaks. I know that Suriname has a diversity of languages as well, and that makes sense to their cultural context and their background. So some of these steps for community readiness, one of the first one is decide with people, and this goes back to seeing the community as partners. So decide with people, not for them. It is very important to engage the community in co-designing the actions, always guiding them throughout the accurate response actions and the accurate information that we have from our other technical colleagues, But it is really important that we make the decisions and the planning of the activities that we're going to have with the community, asking them and taking into account what are their priorities, what is the reality, and transforming that into feasible real steps per action that the community can achieve. I I will make sure that you have this presentation so you can have all the content. And I know that my colleagues in Suriname will send out the presentation. This one of the other steps important for community readiness is strengthen trust through local connections. And this is working with existing networks in the community. We already have leaders, not only speaking about, influencers on Instagram or Facebook. Now let's talk about, the influencers that have always existed in the community, the leaders that are there, the faith-based groups, the youth groups, some other associations, the work unions, and other neighborhood organizations that can help us spread the message and engage them in order for us to improve our work in the community. Show up on schedule, and this connects with what I said before, making regular our visits to a community and always bringing, accountability information, how the response has advanced, and also being honest about what we don't know. These are very important points in order to strengthen the trust within the communities. This is sometimes very hard for all of us working in public health, and I know by experience, but we need to listen more and be talking less. And we really need to get to know what are the community concerns. And there are very, sometimes there are like outrageous false information circulating, but in other cases, there are like very legitimate concerns and doubts that the community have. And we need to listen to those respectfully without judging and trying to respond to a dialogue and a conversation. We also need to document these findings. It's not only the matter of listening, but in order for RCC to become actionable and to have a basis methodology to carry on in the response, we need to systematize this information. I know that many of you as community health workers already do that, but it is important to really find a way to reflect this information in an operational manner, so this information we can report to other teams in the response. And these kind of concerns and doubts that you hear within the community will really help the design of the other response actions needed. Plan with people about the practical solutions instead of giving orders, giving options. Of course, all of these options have to be based on the latest technical guidelines. So never to fall apart from what the scientific and the public health data is showing us, but we can turn this into options and trying to work with the community. What are the actions, or how frequent, or how are the actions have to be performed in order for the actions to work? And also invite the neighbors to participate and involving them in verifying these actions. This is very important for the community to mobilize, and also because we are stimulating the autonomy so that the people learn these actions and perform them in this response. But we know that chikungunya and other vector-borne diseases are endemic to our region, so we will have new emergencies. So we need to prepare, thinking also about the future and how these people are engaged in order for them to perform the actions in the next emergency. And about the messaging, I know that Juvika is going to talk more about this. Here are some tips about repeated, consistent messaging, ensuring that we have the same message across many channels. As I said before, using plain local language, hold the messaging and not change it so often, because sometimes we think, oh, let's do this, and the next week we think maybe that didn't work, let's change it right away. We need to stick to some messaging for a while, and after we have exposed the people, see if there are changes and improvements in the response, so we can go ahead and after a while and after testing those messages, getting the feedback from the community, seeing if there is need to change them or adapt them or using other platforms to put them out. So in terms of next steps and the key takeaways from a presentation, I just want to emphasize that trust grows with time, and this implies being transparent, respectful, being consistent, also providing the information, because if we are not providing the information to the communities in a regular basis, we cannot expect them to trust us. Involving them in the design and in the planning of the activities. I know that this is not an easy task, but we need to start shifting from, giving some instructions to involving them in how they can perform the prevention actions in a way that is feasible for them and effective. Repetition drives action. So this idea of having the same messaging, and our colleagues in the vector born disease department in here at PAHO are very good in that, because they have created a very strong basis for messaging that they have. I know that they have it available on the website, and it's always the same messaging for these diseases that the clinical signs have not changed or haven't changed. So this same messaging consistent in different channels. And of course, you as community healthcare workers or community health workers, our colleagues in the field are essential. There's no technology, no campaign, no policy that can replace those interactions that you have on a day-to-day basis and that you are building every day. So I really want to stress the importance of your work and the importance that you have in order to improve the operational response. And I just want to end by highlighting that we have a virtual course since last year, is more focused on dengue, but the content is also applicable to other vector-borne diseases. I really advise you to take it if you haven't yet. It takes you step by step on operationalizing RCC, and of course, it goes way deeper than what we have talked about before today. I hope this has been useful, and thank you very much.
Thank you so much, Tanya. Just a small remark for those using the interpretation channel. It seems that there might be some connection problems there. Our apologies for that technical error. If possible, please join us on the regular channel to follow in English. And if afterwards you have questions that need clarification, please let us know. Er schijnen wat problemen te zijn met met het vertalingskanaal. Onze excuses daarvoor. Hopelijk kunt u toch gewoon volgen. En als u vragen heeft die om opheldering vragen, laat het ons gewoon weten in de chat. En dan gaan we daar dieper op in. So, thank you once again, Tanya. We're going to our next speaker with a very exotic name, Ljubika Latinovic. And Ljubika is a medical doctor specialized in pediatrics, and she holds a master's degree in health organizations administration and public health. And she has more than 20 years of experience in national, regional, and global level working in health promotion, emergency preparedness and response, and capacity building. She's also an expert in RCCE, and during the COVID-19 pandemic, she served as the strategic communications lead at the WHO WPRO. So she has this ton of experience, and she's going to share all of that with, or a bit of it with us. Ljubika? Please go
Thank
ahead.
you. Well, hello everyone. Yes, that's me with an exotic name. I like that. I'm originally from Serbia, so you know everything about the vector-borne diseases I actually learned in the Americas. I have to say that when I came to live in Mexico. As you've heard, I'm a medical doctor. I worked for Mexican Ministry of Health for more than 10 years. And then I was a PAHO consultant during the Zika outbreak between 2016, 17, 18, a little bit. And then I went to WHO, first to the Western Pacific region for a dengue outbreak, and then to the HQ. So I have quite a lot of experience with the arbovirosis, and thanks to Christina for inviting me to share with you some of the issues around the messages, and especially to just align with what Tanya was saying. Also, it's a huge honor to again present to Suriname. I had a chance to be twice in the country for different workshops on the risk communication, the last one in 2022 for the pandemic influenza preparedness risk communication workshop. So thank you, everyone, and I will share. Um, hmm, why I don't see the present? Sorry, just a little bit. I had it ready, so now it should be ready. Okay, sharing and putting it. Oh, sorry, we were. So here we are. So we will talk, and it really, the Tanya's presentation was really great to give us an overview of the importance of the risk communication community engagement, especially if you are the healthcare workers or the volunteers or the first responders. It's really one of the basic skills to have when we are in an outbreak or when we have a situation that can provoke some uncertainty, that can provoke even, you know, restlessness between the community, and we need to give them some advice, some messages, something to work with. And I actually like the last sentence that Tanya used, that nothing can really change the human touch and the human approach. And as we are the people that work directly with the community, we definitely need to use that and be more open to listen and more open to adjust our intervention and messages as well for the situation that we are in. So when we talk about the messages, and something that is important always to know and be familiar with is the essentials. And of course, what the definition of chikungunya in our case, and how does it transmit, a little bit about the vector. Look, our communities already know quite a lot, and this is important to also acknowledge, because they've been living with Aedes mosquito for ages and for years. So there is a lot of knowledge already in the communities. And this is why listening that Tanya was mentioning is important, because sometimes we would need to adjust a little bit these messages according to what is known or what is not known or what needs to be reinforced. So, as we know, the definition is basic. Chikungunya is a mosquito-borne disease transmitted to humans by the bite of an infected mosquito. The vector, of course, is a female mosquito, mostly Aedes aegypti or albopictus. It's something that is really important for people to know, that the female mosquito is more active in early mornings, which we know, and with the sunrise and the sunset, and after afternoon, this is where they are very active. Urban settings, we talk a lot about urban settings because now people live more in, you know, next to each other, closer to each other. The urbanized area are bigger every time. And sometimes there is not enough water, there are not wash facilities, and basically they keep the water in different containers. So This mosquito is a household mosquito that lives near urbanized areas and can reproduce in any container that contains water. I mean, I think it's only, and our experts, technical experts say more than 300 liters, maybe it's not, but it can be even as such a small container, like a bottle cap, that what we throw when we open the bottle and we throw the cup. It can be as small as that the female mosquito can lay eggs. So this is really important to understand. We don't need a big bucket of water. It can be in a very small place. So when we talk about special risks, part of our communities and vulnerable populations or more at risk population, we know obviously that people with underlying medical conditions and elderly over 65 can have are in the higher risk of the complication. Of course, pregnant women, because of this peripartum transmission to the newborn during the delivery and peripartum can occur, and the baby can get infected. So, and of course, the young children can be bitten by infected mosquitoes, especially in the it's more dangerous in the weeks after birth. So all these risks and knowing who are the population, the most vulnerable population, is really very important, because our messages will also be tailored according to that and according to the situation and the population and the community that we are presented to. So we will, as Tanya explained, the basic thing is to build that trust. Again, the trust is built before even the emergency occurs, and this is where we come all together, because we know our communities and we work with them. So we are building trust even before this situation. So when the community comes to us, there is already win-win situation, and we already can help them understand and better respond to the emergency, like in this case. Symptoms, as we are seeing in other arboviroses, it's onset of fever, but what chikungunya has as a very specific symptom is this intense joint pain. Intense joint pain that can go for days, that can go for months, and that can increase. And this is a kind of a sign that absolutely medical attention is needed, and we need to stress that out. The illness typically begins 4 to 8 days after being bitten by an infected mosquito. Of course, this is approximation. And this joint pain is frequently so intense, and usually, as I said, can last for several days and persist for weeks, months, and even years. Other symptoms and signs include joint swelling, muscular pain, headache, nausea, fatigue, conjunctivitis, and rash. So this is all very important, but that intense joint pain is something that will probably distinguish chikungunya from other arboviral diseases. But again, the only diagnostic, the real diagnostic, can be done by the test. So that's also important to know. So there is no specific treatment or antiviral drugs for chikungunya. We are only treating symptoms, I mean, like a fever, or the pain, and those are the medication that normally address symptoms are, as we know, paracetamol or acetaminophen or metamizole, if available. But again, it's only the symptoms that can be treated together with hydration, rest, and other personal protective measures that we will talk a little bit about. So there is also an important warning that should be one of our messages, that non-steroidal anti-inflammatory medication should be avoided unless dengue can be ruled out. Again, by a test, by clinical manifestations and other things that we can differentiate in diagnostics. Once an individual is recovered, available evidence suggests they are likely to be immune for the future chikungunya infections, which is also important because it might have a little bit of people can be asked, or well, why is in dengue we can get dengue again? Why in chikungunya no? Different things, different virus, different serotypes. So it's important also to understand that. And so what communities can do, apart for being really active, and this is where your role, as Tanya was explaining, comes together. So we need to be present and we need to work with the communities. So of course, when there is no breeding site, there is no mosquito. We know that. That's the basic message. No mosquito, no breeding sites, no mosquito. So eliminating potential breeding sites, such as any water storage containers, typically tires that we throw away, flower pots, places where the water, that the standing water collects. But one of the rumors that we might tackle a little bit later is that it's a dirty water. It's not. The mosquito actually breeds in the clean water. And this is one of the messages that we have been explaining and telling people, trust me, all around the tropics in the globe. So it's important to understand that. So we need to reduce the sources, of course, recollect tires and check that there is no accumulated water in their insides, identify and remove standing water in anything that can actually, collect water. So we say containers, tires, buckets, flower pots, because we see that, but there is always a garbage or something that is thrown or around our houses that can still collect the water. It can be a coconut shell. It can be something, that we don't normally see as something that can collect the water. And of course, special attention, because sometimes we don't see that as a communal space, are the social gathering spaces like parks, like churches, like graveyards, for example, schools, and healthcare settings. Sometimes even in our healthcare centers, around the healthcare centers, we can find the breeding sites. And this is where the community comes together with the healthcare providers, really in this action to clean and to reduce the sources. Mobilizing of the community is critical in reducing mosquito breeding sites, actually to reduce the transmission and, of course, to reduce the possibility of escalating and being even worse than it is. And personal protection is really important. We always talk about wearing clothes that minimize skin exposure to the daily biting mosquitoes. If you remember, in the morning and in the afternoon, especially, the light clothes, light colors, because it's very hot, obviously, where the communities are. So it's sometimes very difficult to pass this message through. Of course, use the repellents as possible. The repellents that have a specific, chemical parts like DDT, IR 3535, and things like to exposed skin or clothes. Again, it's really important to use repellents. This is one of the messages that the communities, it's easier for the tourists to understand this message than people who already have been living with the mosquitoes for many, many years. Use of nets, especially during for the people that are already sick. with chikungunya and any arbovirosis, it's very important to sleep and rest under insecticide-treated mosquito nets, because that's how they protect the others in their household to be beaten by infected mosquito. But it's very important for the young children, or elderly, pregnant women, definitely to sleep under the bed nets. And windows, of course, and doors, screens, if possible, should be used to prevent mosquitoes from entering the home. So those are just some basic personal protection messages. Again, all this is important to be crafted still, and to be translated even better depending on the community that we are talking to. So everyone has a role in community mobilization and community work, starting from the midwives. And all these people that we have listed here are actually trusted sources of information. Still, quite a lot people go to them for the information, for the way, what do we do? Asking for the actionable messages as well. What Tanya said, that's very important, because we need to give communities something to do, how they can mitigate with us. So midwives that explain the risk of vertical transmission, route delivery, and importance of mosquito bite prevention during pregnancy. Of course, vector control personnel that conduct door-to-door visits and explain actually how can the standing water be identified and removed. Community leaders are the ones that invite community to action and mobilize residents, youth groups, teachers, families, even mothers, for example, that are quite important, because they will do quite a lot of this work to schedule the cleanup and a source reduction. Primary care practitioners, as much as they give this first message, an important message, and educate people about the transmission, mosquito, and all that we were signs and symptoms that we were talking about, they're also very important, this scale that Tanya was saying about participating with and listening to the community, because they're actually the first responders, and they can really help how the community comes together. They listen, they know their community, they know what they need, they know how to work with them. So all these people that we listed here are actually should work together in some kind of in the community setting. And of course, civil society and volunteers that can help with vulnerable households, peer-to-peer education. Again, this community feedback collection, that social listening, gathering information and concerns and relying them to the health authorities, very important. So everybody has the role, even a small or a big, it doesn't matter, but coming all together is important to mitigate the outbreak. And Tanya already spoke about this, so just a clear action. So the messages really need to be actionable and convey what people should do or should not do, and why. So it's really important sometimes to explain why. So why do we scrap our containers of water? Why do we have to change it every week? Why? It's very important to give that. Simple, using clear and simple words, of course, with the proper social framing and context. So, because we need to encourage the behaviors, actually. Maybe it's not a change of behavior, maybe just to push a little bit the behavior, maybe just to motivate the behavior. But it's really important, as we know in the messages, to get not only to people's head, but also to people's heart. This is how people move, and this is how people are motivated. And we need whys, as I said, a brief explanation of reasons why things need to be done, and accessibility. So we need to provide multiple versions of messages in the different languages, in the way that it's spoken in the target population, and of course to be socially accessible and acceptable. This is very, very important. And we can talk about rumors and misinformation for sure for another webinar or so. This is very important. This is where the listening comes from, that community feedback comes from, and people in the real world, we know if they have a fear of insecticides. Is it dangerous? How chemical it is? How, what can it provoke? Secondary problems or whatever can come. And this is general. It comes all over the world. Believes that mosquito only breed in the dirty water. And I said, and this is something that we still see and still hear. So this is something that needs to be managed. And the chikungunya spreads from person to person. We still need to explain a little bit of that transmission cycle and how does the mosquito breed and how does it become infected. So we do identify misinformation early, not only through the channels that we have and the community listening, but we have our WhatsApp groups, we have community meetings, we have different channels where the rumors can be picked up now, and then we do need to address them. It's not all every misinformation is important. That would be also something to talk about in the future. But the ones that are actually that can provoke people not to go to the health services, not to seek help, not to participate in the mitigation of the risk are the ones that we definitely need to tackle and definitely need to address. So it's really important to understand that. We need to be transparent and honest, and Tanya talked more about that. When do we respond? What do we say? When we know, when we don't know, so it's very important. And of course, we need to be more present, listen actively, and not just deliver one-way messages, because the risk communication is all about that, and the community engagement even more. Community engagement is putting our knowledge and information really into action, and this is what we need to think about for the future. And I think with that, here you have the information about chikungunya that you can find on the PAHO website. You can scan the code and have more of these messages. And thank you very much. It's been a pleasure. Thank you.
Thank you, Eureka, for sharing that with us. Now we're going to the last presentation, certainly not least. May I introduce Dr. Diego Campos, who is a Guatemalan medical doctor and public health professional and has extensive expertise in epidemiology. Dr. Diego, please go ahead.
Thank you, Ramona. I'm going to share my screen right now. Please confirm if you are watching my screen. I think that, yeah. Now you can see my screen.
It's loading. Yes.
Okay.
We can see your screen.
Thank you. Thank you, everyone. And thank you, Suriname, for the national authorities and our team colleagues in the national office for this invitation. Today, I will share with you Guatemala's experience in community engagement during the dengue outbreak that we had during 2024 and 2025. Specifically, how the national team moved from a central or national communication strategy to a high level of municipal coordination that translated into actions that we saw in schools and communities. This presentation mainly focuses on practical strategies that strengthen intersectoral collaboration and local leadership. First of all, we have to understand how Guatemala is composed, the Guatemala's social demographic context. We are approximately 18.6 million people, and 60% of our population is in the productive age. So that means that people from 15 to 65 years go out their houses, go to work, go to schools, go to universities, and this means that they are exposing every day to the mosquito bite. Also, 50% of our population live in urban areas, and you have to remember that dengue and the other arboviral diseases like chikungunya is an urban, a predominantly urban disease. But in the ethnic characteristic of our population, it's really important for the Minister of Health to recognize that almost 40% of our population self-identifies as indigenous. And this is the key or the main challenge for health strategies in communication, because we have around 20, we have 25 languages, 24 besides Spanish. So, and around 72% of the indigenous people speak a Mayan language like their mother tongue. This means that we have to have messages translated in 24 or 25 languages, but not only using the words that they understand, but using the meaning of the ideas. That is not the same that only translate the messages. In Guatemala during COVID-19, I want to share this experience with you. PAHO National Office conducted an ethnographic study in 110 municipalities. This was this strategy wanted to have some resources for the Minister of Health to know how to direct the messages about vaccination predominantly in adults. So the key finding that we have from this investigation is that the social environment strongly influences health decisions. In this case, deciding to get vaccinated. But we also learned that people need to use local languages to try to disseminate messages, that the positive or the positive testimonials or the positive experiences in any other health topic is more accepted by the community, and that you have to engage with trusted local leaders. This study had 27 reports, one for each health area from Guatemala. And in all the reports, we found that the municipalities and educators are the key leaders, and the loudspeaker messages or communication and community radio is the most trusted media by the population. So we used these lessons directly from in our dengue communication strategy, and I'm going to show how we translated this into action. As you know, as we spoke on this webinar, dengue is not only a health issue, it's also a social, economic, and environmental issue that have direct consequences in population. Affects family dynamics, affect community trust in institutions, principle in health authorities. Economically, impacts in productive age populations. As I told you, 60% of Guatemalans are in this group, and increases household and municipality expenses in care and in environmental care. So this broader impact justifies a multi-sectoral involvement beyond the health sector. And in the school dynamics, we know that there is a strong impact from our viral diseases. We have references and evidence that each student can lose, on average, 5 to 8 days of school, because we know that this is the acute phase of the illness if they don't evolve to severe forms of the disease. But during epidemics, absenteeism ranges between 10 and 15% of the people who go to the school. We are talking about teachers, we are going about talking about students, we are going all the people that go to the schools. So we know that the impact in the community around the school is really strong. And in Guatemala, 40% of the cases during 2023 and 2024 occurred in children under 15% of the 15 years old. And in Guatemala, 31% of the population is under this age. So this is why it's important to know how is composed the demographics of the country, because the most affected people is in a one place, the schools in this case. This clearly positions that the education sector is our critical partner for an outbreak response. So our strategy focusing on a cross-sectoral approach. We worked with two main pillars, the education sector and municipal governments. We conducted a series of webinars with local education authorities and teachers from each local, from the principal local, from local levels and from the main areas with higher incidence and deaths. Also, we prioritize meetings and webinars with majors and national authorities from the central government to align messaging and coordinate local actions through community recognized leaders, in this case, majors and educators. First of all, we have meetings with mayors during technical visits that we made to Guatemala during 2024 and 2025. Uh, we uh, uh, we made direct engagement with mayors as an essential component of our integrated management strategy for arboviruses. We visited the mayors along with health authorities and discussed their leading role in responding to the emergency affecting their communities. You have to remember that they are elected leaders from the communities. These meetings resulted in the activation of the municipal emergency operation centers that are mechanisms in the country that allows the mayor to promote cross-sectoral coordination and to mobilize additional resources to respond or attend an emergency. So this approach with the majors shifted dengue from being seen solely as a health issue to a municipal governance priority. And political leadership enables faster coordination, resources mobilization, and for sure community trust. Municipal leadership plays a catalytic role in dengue and chikungunya and other arboviral diseases outbreaks because it strengthens community participation, primarily eliminating breeding sites of the mosquito. It accelerates interinstitutional coordination, not only with health sector, but academic sector, private sector, industry, tourism, and other areas that have a key role in the response, and also promotes regulatory updates and improvements in public services, access to water, waste management. So, in short, municipalities become operational drivers of prevention. When when we align three actors like health services, municipalities, educational institutions, each one of them can contribute with capacities, messages, media access, infrastructure, community reach. And the core messages that we share with them focus on eliminating breeding sites inside the schools, inside the houses, and around the communities. Also preventing mosquito bites, seeking timely healthcare when there are warning signs, and also protecting public spaces like parks, public markets, and schools. The goal was the message consistency across all sectors. So this is the how we translate meetings into action. Coordination alone is not enough. It must translate into visible actions in the community. We have meetings and visits. You can see in the first pictures with the principal of a school in one municipality in Guatemala. Also, the vector control team from the Minister of Health visited the school, and this led to the application of chemical measures from the control of the mosquito and the first national guidelines for control of dengue in schools. So this is the first interprogrammatic approach to response to the dengue outbreak. But also, when the kids and the children are educated about the importance of mosquito prevention and dengue recognition, the communities organized and mobilized student marches and handmade signs and meetings inside the schools to raise awareness about the vector, the disease, and the environmental hygiene that is necessary for this response. So this helped to transform communication into behavioral change. And this is the main goal of this intervention, because it also reinforced visibility and public trust in municipalities and health authorities. Uh, Working with the national authorities, we established an intersectoral communication working group that included health authorities, the mayors of municipalities, delegates, civil protection, the Minister of Interior, educators, journalists, and the Army, because all of them together can work to facilitate or coordinate message dissemination, news publication in local and accepted media, rumor monitoring, like the past presentation said, and engage and promote community participation for cleaning activities. This structure ensure coherent and rapid communication during peak transmission and develop a really strong and coordinated answer in the local in the local scenario. And when I mentioned in the ethnographic studies, we know that Guatemala it really trust in these loudspeaker announcements. In Spanish, it's perifoneo. So we played pre-recorded audios in high incident areas. Um, Using a really familiar and trusted local communication channel, no, that is hearing the message in their local language. We use mobile units and municipal and health workers with megaphones walking through the communities and spreading the message for vector prevention and warning signs recognition. Um, Also, we shared the audio recordings and messages with local markets and community radio stations so that they could play these audios in different times during the day. We prioritize parks, schools, markets, and high-risk communities using these cultural and familiar channels to increase credibility and reach. So to conclude, my final messages of this intervention in Guatemala is that education and community participation are are the core working area in the communication for arboviral control. That you have to know that there are different audiences and they require tailored messaging using language that each of them can understand. It's not the same message for a political or a stakeholder than for a family or a mother of a children, that the intersectoral collaboration is essential to mobilize resources effectively, timely, for a really integrated response, and that the municipal leadership is critical to sustain coordination. The objective of this intervention is not only to reduce cases and deaths by arboviral diseases, but to promote healthier environments and for our families and communities. So thank you for your attention, and I'm seeking for your questions. Thank you, Ramona.
Thank you so much, Diego. So we've come to the end of the presentations. If you have a question, please mention it in the Q&A section. You can just type it in, and then one of our panelists will address it. No questions? It was clear. We will be sure to send you the presentations. After this session, we'll make a compilation of all the presentations and be sure to compile a mailing list and make sure that you get them as well. Okay. I would like to thank you for your time. I would like to thank you for your attention. And if there are no more questions, I would like to thank everybody for their participation and their input. And I really do hope that together, we as a community in Suriname facing this health emergency now can use these tools and this information that we've gathered to fight at the moment to create more awareness against the chikungunya virus in our society. Thank you so much. And I do wish you a pleasant continuation of the day. And thank you to all our speakers.